Hello, I'd like to welcome you to my presentation of Experts Evaluate the Contributions of Psychological Research. There are so many career alternatives in the field of psychology. A person graduating with a bachelor's degree may decide to just go to work in the workforce with that degree. However, the graduate may also decide to further their education to a higher level and pursue a master's or even a PhD. There are various career alternatives to choose from, as well as subfields in psychology too. Some of these include counseling, music therapy, art therapy, dance therapy, clinical counseling, psychology, developmental psychology, educational psychology, forensic, industrial and organizational, psychiatry, and so many more. However, this would be a good time for the individual to ask themselves a question. What type of contributions have different fields in psychology made, and what sort of methodological issues are psychologists faced with? Answering these questions for us today are Dr. Ronald William Maris and Dr. Mace Beckson. Dr. Ronald William Maris is a forensic suicidologist and professor at the University of South Carolina. Dr. Maris has authored or edited 21 books, and he was originally trained as a behavioral scientist. He has a PhD in social psychology and sociology from the University of Illinois. While at Johns Hopkins, Maris performed both psychotherapy with inpatients and outpatients. He has also been funded with over $2 million to perform basic suicide research. He became very instrumental with his work as a treatment team member for inpatient care and did treatment and research in the Hopkins Psychiatry Emergency Room and at Sinai Hospital. Expert number 2 is Dr. Mace Beckson. Dr. Beckson is a UCLA Health Sciences Clinical Professor of Psychiatry and Biobehavioral Sciences. He is also an addiction psychiatrist at the VA Greater Los Angeles Healthcare System. Dr. Beckson obtained his AB magna cum laude in biochemical sciences from Harvard College and his medical degree from Cornell University Medical College before completing his training in psychiatry and behavioral neurology at the UCLA Neuropsychiatric Institute. Dr. Beckson directed the Psychiatric Intensive Care Unit of the VA Greater Los Angeles Healthcare System, and his focus of work was on the risk assessment and risk management of suicidal and violent patients with substance-induced and primary psychotic disorders and mood disorders, along with addiction, dual diagnosis, addiction and pain issues, PTSD, and hospital safety. Let's take a look at expert number 1, Dr. Ronald William Maris. Dr. Maris works in the field of forensic suicidology. His job is to study suicidal behavior and focus on suicide prevention. Dr. Maris shares the view that suicide is largely preventable with the right actions or knowledge and even a change in society's views. Dr. Maris also provides enormous insight into the medicalization of suicide and the issue that millions of Americans are taking antidepressants since the 1950s. He argues that these actions are partly driven by carefully guarded economic interest, where billions of profits have been made. He shares the view that these actions are not entirely a cure for suicide because suicide rates have increased. Suicide is an important public health issue that involves psychological, biological, and societal factors. After a period of nearly consistent decline in suicidal rates in the United States from the era of 1986 through 1999, suicide rates have increased almost steadily from 99 through 2014. While suicide among adolescents and young adults is increasing and among the leading causes of death for those demographic groups, suicide among middle-aged adults is also rising. Now let's take a look at our expert number 2, Dr. Mace Beckson. He believes that suicide may not be the result of just overprescribing of antidepressants or economic interest, because mankind has utilized psychoactive substances throughout history. One of the issues that began with psychoactive substances started right here in the United States. This was when there was the heavy use of hard liquor in colonial America. Then there was the widespread use of narcotic-containing patent medicines in the 19th century. As if these were not enough, then there was the cultural embrace of the cigarette in the middle of the 20th century. Substance abuse even increased more significantly with the widespread use of marijuana during the 1960s. To make matters worse, there is also another substance to note, and that is the crack epidemic of the 1980s. Dr. Beckson does share the opinion that certain psychoactive substances may have profound effects on mood states, and they can also have an effect on a person's cognition, behavior, and physiology. Dr. Beckson shares with us that there are more factors related to substance abuse too. These could include depression, psychosis, economical, and other biological issues. However, drugs and substances can influence how we function in our interpersonal and social contexts. And of course, yes, substance abuse can also lead to death or suicide. After taking these issues into consideration and the points of views that our experts share with us, we might also want to ask, what does other research have to say regarding suicide and substance abuse? Well, research reveals that there are several other components that are involved and responsible for substance abuse and suicidal tendencies too. Some include genetics. Suicide completion rates are significantly higher in males than females in most societies. Although gender differences in suicide rates have been partially explained by environmental and behavioral factors, it is possible that genetic factors through differential expression between genders may also explain gender moderation of suicide risk. We also want to take into account affective disorders. The association between affective disorders and suicide risk is strong and consistent across several research studies. Then we have economical issues. A decline in the economy at a national or regional level is generally associated with higher suicide rates in time series studies and cross-sectional regional correlative studies. But there are also other reasons that people commit suicide, and our experts agree upon this, is that they turn to substance abuse because of depression, psychosis, impulsive behaviors, crying out for help, and even terminal illnesses, just to name a few. Dr. Maris and Dr. Beckson have shared two different types of opinions with us. Dr. Maris feels that physicians overprescribe antidepressant medications to their patients, and there's huge economic interest involved, and this leads to suicidal behavior. Dr. Beckson believes that mankind has been utilizing psychoactive substances since the beginning of time, and this results in odd behaviors and suicidal behaviors as well. But the one thing that they do come together on is that as psychologists, we have the responsibility to protect the health and welfare of our patients. Pursuing worthy research projects will help us to test our hypothesis while we continue to seek scientific validity and scientific value. These two professionals are subject matter experts who appear to share a conflict regarding suicidal behavior within their research endeavors. However, they really do not. Human behavior is complex, and humans behaving ethically within context can mean that scientists must discuss and sometimes debate the proper actions and procedures of science. I'd like to take this time to thank you for viewing my presentation on Experts Evaluate the Contributions of Psychological Research.